Hello, everyone. Thank you all so much for joining me. My name is Casimir Delphin. I'm an interventional pain physician in Northern California. Our practice is called IPM Medical Group, and I've been in practice here at IPM for about 23 years. I'm an interventional pain physician, and I've engaged in a lot of different interventions in order to help my patients control their chronic pain. I've also been doing research for the last 15 years, and I've been honored to be involved in some of the most cutting edge research and bringing new technologies to be able to treat my patients better for their chronic pain. I have over 70 publications, and I've written a lot of book chapters on interventional pain management, and in particular, spinal cord stimulation. And it's my pleasure to speak to all of you tonight about a breakthrough treatment in chronic pain. And we're going to get into a lot more detail about this right now. Tonight, we're going to talk about chronic pain and all the treatment options that may be available out there for it. Then we're going to talk about the unique benefits of HFX or the HFX solution and how HFX can potentially provide you with long-term pain relief. And if you're wondering what HFX is, stay tuned. In the next few slides, we're going to talk about it in a lot more detail. Studies showing long-term pain relief is incredibly important, not only for the clinicians and the scientists, but it should also be important to the patients as well. So we'll look at the studies that have shown how HFX can provide the patients with far better chronic low back and leg pain relief. We're also going to talk about what to expect from the HFX solution and how to have a conversation with your own physician about the HFX solution and whether it's the right type of treatment for you. Insurance coverage is incredibly important. We'll touch on that tonight. And we'll hear some stories from people who have regained their independence using the HFX solution. And I think a patient-centric presentation like this one should actually start with the patient stories. So we'll start with Jerry, who's actually one of my own patients. That's her on the beach on the right side. She had really bad scoliosis in her spine with a lot of disc degeneration and pinched nerves. And for those of you who don't know what scoliosis is, it's basically a tortuous spine, a spine that has a lot of twists and turns in it. And unfortunately, she was born with that, but it was pretty much debilitating her. She was housebound and she couldn't do anything without pain. She was looking for pain relief, and more importantly, she wanted to be able to get out of the house and stop all her medications. We tried her with the HFX solution. She loved it. We ended up implanting her with the HFX solution, and she was able to get incredible pain relief. She actually told us she was 98% pain-free and was traveling all over the place without any problems. In fact, the picture that you see on the right side is her attending her granddaughter's wedding on the beach in Jamaica. These are the kind of super success stories that excite me as a physician and obviously excite the patients as well. Not everybody can get 98% pain relief, but we all agree that anything that can potentially improve the patient's pain on a long-term basis is a huge step in the right direction. So treating chronic pain can be very challenging. It can last for several months to several years despite appropriate treatments and natural coping efforts. Pain can be very different among individuals. Two different people can have the same type of illness or the same type of injury or surgery, but their pain presentation and the amount of pain they suffer from may differ from each other from night to day. There are all kinds of different types of pain out there. The two main ones are nociceptive and neuropathic pain. That's doctor jargon for mechanical pain or nerve pain. Mechanical pain is nociceptive pain. It's the pain that patients feel with arthritis in their knees and hips. Neuropathic pain is nerve pain. And nerve pain is what we try to treat with the HFX solution to the best of our ability. A lot of patients have a mixed nociceptive neuropathic pain picture, and they may be suffering from both mechanical and nerve pain. So what is nerve pain? Well, it results from a damaged nerve and nerve fibers that are sending the wrong signal to the brain. An injury may have been present at some point. The injury may have been long gone, but the wiring sends the wrong signal to the brain. Damaged nerves can overproduce the pain signals, and the stronger the pain signal, the stronger the pain. With nerve pain, it's really generally harder to identify the source. In fact, one of the most common questions for my new patients when they come to see me is, where is this pain coming from? Can we just go to the source and fix that problem? And frankly, my answer more often than not is I don't know. I really don't know. The problem may have been fixed a long time ago, but the nerves continue to send the wrong pain signal to the brain. It may come from illness, injury, or no identifiable source at all. But make no mistake about it, pain, doesn't matter whether it's mechanical or nerve pain, is very complex. It has the physical component, which we all know about, but there's mental and emotional components to it as well. The more pain you have, the more depressed and anxious you may become. The more depressed and anxious you are, the more pain you're going to suffer from. As a physician, I have all kinds of different tools in my toolbox to try to treat the patients, and they have different tiers for it. For example, the first tier can be things like physical therapy and exercise, which is by far one of the most important things we can do for our patients. We want our patients to increase their function while they're reducing their pain. That's why we engage in physical therapy and exercise. Lifestyle changes can make a big difference. If somebody's obese and they're having back, hip, and knee pain, maybe some weight loss is indicated before we start any medicines or do any type of interventional therapies. Medicines can be indicated, although we don't use medicines the way we used to. Pain medications, specifically opioids, have a lot of side effects. There's physical dependence, and there's a rate of addiction with it. This is the reason why we try to stay away from medications as much as we can and engage in more conservative measures to try to treat the patient's pain before we get to medications. But the next tier, if those things fail, is things like nerve blocks, epidural steroid injections, and nerve ablation. I do thousands of nerve blocks and epidural injections in my practice per year. And I know that they help the patients, but they never help on a long-term basis. If we're lucky, we get about 4 to 6 weeks worth of pain relief from each injection. Nerve ablation, on the other hand, is a very good therapy for the right patient, and it can provide the patients with about 6 months worth of pain relief. But that indication is very limited to certain patients with certain types of conditions, and it's mostly for mechanical pain. There's also pain pumps as the last tier. Pain pumps are medications infused at a much lower concentration right next to the spinal cord. They've fallen out of favor in the recent past, mainly because of the fact that they're still medications and the patients can suffer from the same type of side effects that they would from oral medications as well. Surgery can be indicated, but then again, the results of surgery can be very limited and the patients may continue to suffer from their chronic pain. Last but not least is spinal cord stimulation, which is near and dear to my heart. This is the reason why I'm sitting in front of you today and presenting on the HFX solution, which is the next frontier in spinal cord stimulation and by far one of the best therapies out there. But before we talk about HFX, let me tell you what spinal cord stimulation is. Spinal cord stimulation has been around for 55 years. It's nothing new. It's a way for us to send very minute electrical impulses to the spinal cord, which will in turn mask the pain signal from going to the brain. The way I explain this to my patients is that, hey, when you hit your funny bone, what do? You take your hand and you rub that area with your other hand. And the reason you do that is because the tactile sensation, the touch sensation, distracts the pain signal from going to the brain. Now imagine a very sophisticated system doing the exact same thing right over the spinal cord for chronic debilitating pain. Despite the fact that spinal cord stimulation has been around for over 55 years, the long-term data for it, especially for low back pain and leg pain, was quite limited. This is when HFX came into the picture. After about 12 years of development and research, the FDA approved HFX solution as the new frontier in spinal cord stimulation in 2015. And this was indeed a comprehensive solution to treat complex, dynamic, and the unique nature of chronic pain for the patients. The FDA looked at a lot of data, including a very important scientific research study that I had the honor of being involved in, before they approved this device to be used here in the United States and also around the world. It's one of the most advanced spinal cord stimulator devices available on the market, and it eliminates a lot of the limitations that the traditional spinal cord stimulators have had over the years. In fact, This chart can show you exactly what's happening between and the differences between HFX and traditional spinal cord stimulation. Look at the top line, the most robust body of clinical evidence in spinal cord stimulation. And that's no joke. The HFX has been studied time and time again with some of the best scientific evidence in history of spinal cord stimulation. And traditional SCS, despite the fact that it's been around for a very long time, continues to have good but very limited scientific evidence for it. There's significant relief for both back and leg pain with HFX. That's not to say that traditional SCS doesn't work for low back and leg pain. It actually does, but the long-term data can be anemic, and HFX simply works far better for the treatment of chronic low back and leg pain based on the scientific evidence available to us. It offers programs that can be used while sleeping and driving. This is unique to HFX because it uses a frequency that doesn't cause tingling for the patients. So the patients can use the device 24 hours a day, 7 days a week, and they can get better sleep and function better during the day. And they can also drive based on the FDA labeling for the HFX device. It offers programs without a tingling sensation that reduces the amount of jolting. So as the patients move back and forth, they don't have any unpleasant jolting. By the way, the tingling may be very pleasant with traditional SCS at the beginning, but it can become cumbersome and very annoying for the patients in the long run. HFX offers high frequency spinal cord stimulation at 10,000 Hertz. This is unique to HFX. No other company can offer that to anyone. But aside from that, it can also offer any other frequency that has ever been studied in the human body in the same device. So this is by far the most comprehensive solution in terms of spinal cord stimulation for my patient population and potentially your case as well. The battery is designed for a 10+ battery life. The device is a rechargeable device. It needs to be charged once a day for about 30 minutes or so. And guess what? I was involved in the randomized controlled trial that was performed before the FDA approval back in 2012. And I still have patients who continue to enjoy excellent pain relief using their original battery from 2012. We're getting into 2022 fairly soon. I bet you anything that some of these patients will trickle back in order for them to be able to get their battery changed at that time. As I said, I had the honor of being involved in one of the largest studies ever done in spinal cord stimulation for the study of low back and leg pain. This was a randomized controlled trial that we scientists and physicians considered the gold standard in the type of scientific evidence available to us. In this study, a whole bunch of patients with chronic low back and leg pain were randomized to the HFX solution or traditional spinal cord stimulation. And we followed these patients for a full 24 months, long term, 2 years of follow-up in these patients. And what we were able to show was that with the HFX solution, the patients were able to get about 77% pain relief in their lower back and 73% pain relief in their leg pain with the HFX solution versus about 50% with the traditional spinal cord stimulator patient population. So the results were good in both arms of the study, but HFX clearly did far better for the patient population. And this is the reason why it's my choice for my patients. So people also achieve long-term relief from HFX therapy in the real world because the scientific studies are all good and dandy. That's wonderful that we could get that kind of data. That's the foundation. But what happens in real life? Well, there was a study with real life patients just like you in the real world enjoying HFX therapy for their chronic trunk and limb pain. The study was conducted on 1,600 patients worldwide, and these patients were able to show how 74% of them were able to get 50% or more pain relief in their low back and leg pain at the 2-year mark. Aside from that, there was a 72% improvement in their function, a 68% improvement in their sleep, which doesn't sound like much, but to me, that's amazing. If I can help my patients sleep better, then they're going to function better during the day and they're going to be better people for themselves and for their family members. And the quality of life improved by about 90% in these patients as well. You may be asking, okay, well, that's great. That's yet another study. How are your patients doing in your practice? And this is a snapshot of my own patients that I've treated with HFX therapy in my clinic here in Northern California. There was a 72% reduction in the medications used for the patients. And that's huge to me. If the patients are taking less medicines, that means they have less side effects. If they have less side effects, that means that they can function better. There's less trips to the pharmacy and less co-pays paid. All of that is music to my ears. 85% of them were able to achieve long-term pain relief. And with long-term, I mean years. I'm not talking about months or weeks. 84% of them have improvement in their function, and 89% reported an improvement in their sleep. Once again, huge success all the way around for my successful HFX therapy patients. So who's the best candidate for HFX? Well, people who have debilitating pain after trying surgeries, physical therapy, and medications could potentially be good candidates for this. But patients themselves can't determine whether they're good candidates for an HFX solution. This is the reason why they need to be able to see a doctor like me in order for the two of them, physician and the patient, determine if the patient is actually a good candidate for the HFX solution. Some patients may not be good candidates for surgery, and they continue to suffer from low back and leg pain. Some of those patients may be excellent candidates for the HFX solution. People who want to decrease their medications or avoid pain medications altogether may be excellent candidates for this type of therapy. Potential candidates are people with spine pain, arm pain, leg pain, foot pain, hip and knee pain, and also groin pain can be excellent candidates for the HFX SCS and the HFX solution. So what's the process? Well, first and foremost, you go and see your physician, a physician like me, who offers the HFX solution. And if your physician doesn't do that, we have a way for you to get referred to the right physician who can actually at least speak to you about what the HFX solution is and whether it's the right therapy for you. At your consultation, your provider will evaluate your condition and decide whether if you're a good candidate or not and answer all your questions about HFX. If you're a good candidate, then you go through a temporary trial. The patients get to test drive this system before they get the permanent implant. And in my opinion, that's by far one of the best benefits about it. The trial is incredibly simple. It takes about 15 minutes to do in an outpatient setting. The wires are placed through needles right next to the spinal cord. The wires will be coming out of the skin and they get connected to an outside device. And the patients use that for about a week. And the patient himself or herself will decide if this is the right therapy for them. They will consult with their physician at the end of the trial, and the physician will pull the leads out in the office within 3 to 5 seconds. It's a very simple process. And if they're a good candidate, then they move forward to a permanent implant. The permanent implant is also an outpatient procedure. It takes a little while longer. It takes about 45 minutes to an hour to complete. And a small device is implanted under the skin, and the wires are run through needles again, right next to the spinal cord. And the patients are sent home the same day. There may be a little bit of pocket pain and incisional pain from the surgery for just a few days, but within 4 to 6 weeks, the patients don't really feel the device anymore. And it just helps them with their pain overall. Using the HFX system, patients can start to have pain relief right away. I usually tell my patients that it may take 24 to 48 hours before they start to see some relief. But as long as they're patient and the setting can be adjusted by the representative from the company, we could potentially get there very quickly. These are all the different components in the HFX solution. That's the trial battery on the top left. The leads are placed, the leads look like the wires on the right side, as you can see. And then as they're coming out of the skin, they get connected to that outside device, which is actually smaller than my cell phone here. And that goes into a pocket right at the waist of the patient. The patient uses it for about 6 to 7 days, and they come in and they say, Dr. Amir-Delfan, I love it. It helped my pain. I walked more, I stood more. I was a better person for my family. I absolutely want it. Or they say, you know what, it didn't help me and I don't want it. And by the way, 9 out of 10 patients in my practice move forward to a permanent implant. The permanent implant looks just like what you see on the right side. It's a small device. It looks like a pacemaker. And the leads are implanted, and that particular device is implanted within the subcutaneous fat, usually right above the belt line in the patient's lower back. The bottom right is the remote control. The remote control will help you turn the system on or off, increase or decrease the amplitude, or choose from different programs, very much like a TV remote control. You, the patient, is in full control of the remote, and you can control the system. But don't think that after the implant, you're going to be alone. With this particular system, there's an entire team ready to help you outside of the company representative to be able to optimize your solution for you to get the best therapy possible out of your HFX spinal cord stimulator. The bottom left shows the charger. That's a charger for the IPG, or what we call the battery. And the charger is used every day. It's a wireless charger, so you're not exactly plugged into the wall or anything like that. It just goes in your pocket. That little blue paddle sits on top of the battery to charge it for about 30 to 45 minutes every day. That has never been an issue for any of my patients, because almost all patients get such good pain relief that they're happy to charge the device just like they charge their cell phones or their iPads every day. Insurance coverage. I know every single one of you is thinking, is my insurance going to cover this? And the answer is absolutely. These devices have been around for a very, very long time, and insurance covers all of them, especially the HFX solution, because it has far better evidence than even traditional spinal cord stimulator out there. Aetna, Humana, United Healthcare, Blue Cross and Blue Shield, and especially Medicare cover the HFX solution for patients with chronic pain in the trunk and limb. And most recently, the HFX solution was also approved by the FDA for painful diabetic neuropathy. And we're delighted to hear that, because that's a very challenging problem to treat. And the HFX solution has been proven to be very helpful for that patient population as well. Most states' Medicaid policies also cover HFX. Workers' comp in all states covers it, except for Washington state. There's some difficulty here in California with HFX and also spinal cord stimulators altogether, but we're hoping to be able to resolve those issues in the near future. Some VAs are also offering HFX within their interventional pain clinics. And any specific plan questions, including out-of-pocket costs, can be answered by doctors like myself or your insurer. There's a lot of common questions that come about HFX. Is it safe? In one short answer, yes. It safely stimulates the spinal cord to interfere with the normal sensory perception. It doesn't interact with anything else. It doesn't numb you up. If you step on a nail, you're still gonna feel that nail. If someone comes and pinches your back or your leg, you're still gonna feel it in the same intensity that you did before. The HFX solution treats the chronic pain. It doesn't mask the acute pain, which could potentially protect you from hazards out there in the environment. I've tried everything else. Why should I try this? Well, first of all, if everything else has failed, then this may be one of the best solutions for you out there. Even if you've tried traditional spinal cord stimulation in the past and it's been a failure, this may still be an excellent solution for you. And you should absolutely at least talk to your physician to see if you're a good candidate for it. Will I feel anything? Well, with this system, no, you don't. Unlike the traditional spinal cord stimulators and any other thing out there, there's no tingling associated with it. This device works in the background in order to provide the patients with some of the best pain relief possible without interfering with their daily lives. But if a patient by any chance wants the tingling from time to time because it feels good to them, this particular device can also do that for the patients as well. By the way, HFX is the only device on the market that has been labeled as paresthesia-free or tingling-free by the FDA. Is the trial procedure reversible? Absolutely. The leads are put in within 15 minutes and they're removed within 3 seconds. In fact, for that matter, even the permanent implant is reversible. If by chance your pain goes away after a few years and you don't want the device anymore, the device can be very easily explanted in an outpatient procedure of about 20 to 30 minutes. Can I turn my device off if I need to? Yeah, absolutely. You have a remote control to be able to not only turn off your device, but choose the different programs or increase or decrease your amplitude. Can I have an MRI scan with an HFX system? And the answer is yes. The HFX system has been FDA approved for full MRI body and under certain conditions. And the conditions is basically some minor adjustments that need to be made on the MRI system for the patients to be able to undergo an MRI scan. But the short answer is yes, absolutely. You can have an MRI with the HFX solution. We started with one of my patients. We're going to end up with another one in this presentation with one of the other ones. This is Chris. He's an absolutely pleasant guy, and I'm so delighted to have him in my practice. As you can see, he and his wife are very much into sailing, and they live here in the Bay Area, and they spend a lot of time on the sailboats. And what he told us was that at age 71, I can get back to enjoying my life thanks to HFX for providing me with 80% pain relief consistently. These are the kind of patients that make me happy and give me the sense of accomplishment that I have from providing them with this type of therapy. So what's the first step? Well, you have to study it more. Don't listen to me. There's actually a website at www.nevrohfx.com where you can go and actually read up on HFX to see if it's the right solution for you or not. My presentation today should just be the preamble for you to become curious about this. Go to nevrohfx.com, read up on it, write down your questions, and maybe find a physician in your area that actually offers you this kind of a solution for you to be able to go have an educated discussion about if this is the right treatment for you or not.